Okay, everybody, thank you so much for being here. We are thrilled to announce this exciting program that we're going to launch. I want to start off by doing some introductions of the team because this is no small feat. There are 5 large partnerships here, public-private partnership, that are going to try to implement an innovative program that's going to change healthcare in the Mississippi Delta. So let me do some introductions first. We have, of course, the governor of our great state of Mississippi, Governor Phil Bryant.
Thank you.
We also have Dr. Jimmy Keaton, our Vice Chancellor of Health Affairs here at the Medical Center and Dean of School of Medicine. We also have Kevin Cook, our CEO of the Adult Hospital. We have from GE Healthcare, Tony Holland, General Manager of the Gulf Coast region. Michael Becker, Director of the East Zone of Government Marketing. From Intel GE Care Innovations, we have Jim Pursley, VP of Sales and Marketing. From Spire, we have Terrell Knight, VP of Government and Economic Development, and Sherry Stegall, Senior VP of Sales and Customer Operations. And North Sunflower Medical Center, represented by Wayne Walters, the administrator there at the Medical Center. So I'm going to turn it over now. I'm going to have Governor Bryant speak and then Dr. Keaton, and then we're going to show you a demonstration of how this project is going to change healthcare in the Mississippi Delta. So thank you, Governor Bryant. Let you have a few words.
Thank you, Dr. Henderson. 2 years ago, we started talking about healthcare as an economic driver and how we would improve it and how we would bring together public and private entities to do so in a revolutionary way. Now, we've had some success throughout the state of Mississippi, a new medical school that you'll see just outside if you hadn't had that opportunity, but telehealth, telemedicine, we knew was the future. And so as we were meeting with GE Aviation a year or so ago, we talked about GE Healthcare. And David Joyce, who heads the aviation division, was there in Paris, France, and said, well, I'll be glad to call the healthcare division of GE for you because y'all are doing such a remarkable job assembling our jet engines there in Mississippi. We know we can help with healthcare. Before long, the call came through and the meetings began, and immediately I called the University Medical Center. Dr. Christy Henderson stepped in and has been a leading innovator in telemedicine in the state. Dr. Keaton, a visionary for this great university, this great medical center here. But it was GE and Intel and Spire as they came together and said, we will invest. As private entities, we will invest in the state of Mississippi, and we believe that we can touch the lives of 200 of the worst cases of diabetes in Sunflower County and throughout the Delta. And then, of course, North Sunflower Medical Center. Now, when I was a young boy in Sunflower County, we had a country doctor. His name was Dr. Phillips. Dr. Phillips delivered me in 1954 and took care of us no matter what our ailments. He would come to our house. He would tend to our grandparents and our parents. He did a remarkable job. He never stopped working. I would love for Dr. Phillips to have been here today to see now where Sunflower County will be in telemedicine and how we'll help lead the world. And of course, Spire. Terrell Knight, as I often says, is the best salesman in Mississippi. A company that was founded here in Mississippi. It stayed here in Mississippi. It has grown here. And now using their technology, their investment to broaden the width band to make sure that we have the capability of providing telemedicine to homes and to those in the healthcare community there in Sunflower Medical Center. This is what I have dreamed of. This has been the vision. This has been the goal. And now it's all coming together. GE could have gone anywhere in the world. Literally, there were, at the time we discussed, there were ideas of going to another country and to bring this innovation somewhere else. No, I said, please come here. Unfortunately, we have a large population in the Mississippi Delta and throughout Mississippi that struggles with diabetes. My mother died of complications of diabetes. My father was a diabetic. I understand from a personal level how difficult this disease can be. And now to know that we will change the lives, not only of the 200 patients that will be a part of this study, but thousands, generations hence will look back and say that diabetes treatment was changed forever. And it started in Sunflower County. So I want to thank the Medical Center, GE, Spire, Intel, GE Care Innovations, all those that have been involved. This will be the day that healthcare in the Delta changed forever, and we were a part of it. Thank you. Thank you, Dr. Keaton. Thank you.
Dr. Henderson and Governor Bryant, thank you very much. And I welcome all of you to your University of Mississippi Medical Center. This belongs to all of you. It belongs to all citizens in Mississippi, and we're proud to be part of this huge partnership. That's what it's all about. We're one of 141 academic medical centers in America, and the only one in the state of Mississippi. And we have the traditional missions of research, patient care, and education, but our number one mission is to improve the health of Mississippi, and this is an example of doing that. I can assure you, when this domino falls, we've got plenty more, Governor, that we'll be coming to you with and show you some other dominoes. But thank you for being here. I'm anxious to watch this work. This is a very important room to us. This is where we would run a disaster out of for Mississippi for the health care, and we can basically help the whole state of Mississippi out of this room with this wonderful technology here. So thank you for being here, and thank you, Governor Bryant.
Thank you.
Commissioner.
Okay, I'm gonna let y'all have a seat and we're gonna show you how this works, because this is the exciting part. This is about changing the traditional healthcare model and bringing in another layer of healthcare into the patient's homes with technology. So we're excited to show you that. So we're first gonna have a video clip where we actually have a patient from Sunflower County interacting here and using this technology, which is on a tablet and utilized in their home, so that we can have a better snapshot into the patient's life and their health status so that we can intervene earlier.
Diabetics in the Mississippi Delta now have a better way to maintain and control their disease. Thanks to the Sunflower Rural Health Clinic's strategic partnership with Care Innovations and others to offer a program where blood sugar levels are taken by the patient and then entered on a tablet, where it is immediately recorded and viewed by the staff at Sunflower Rural Health Clinic. If there is an issue or concern about the patient, a nurse will call the patient and schedule an appointment for them to adjust medications and help regulate diet.
Miss Collins? Hi, this is Brenda from the clinic. How are you today?
I'm fine, Brenda. How are you?
Great. I've been looking over your blood sugar readings. You've been running high lately. I really think you need to come in. A little concerned. We need to make some adjustments and try to get those readings back down to normal. Can you come in today?
This up-to-the-minute technology and monitoring service can help save lives, as well as assist patients in managing their diabetes more efficiently and comfortably.
This is going to be a great program.
So that's a glimpse into how this will actually work. And so it is about real-time health monitoring and using tablets and technology to come into the home and change healthcare for these patients. The patient gets to stay connected with us, and we can educate them and empower them to make behavioral changes that will change their life forever. So you can see here on our left, this is an additional piece to this. So not only do we have the patient that can interact with the tablet, but we have our healthcare professionals, our team of professionals here, our ophthalmologists, our nurse practitioners, our endocrinologists, pharmacists, nurses, it doesn't matter who it is. All the resources we have here of a multidisciplinary team can be brought in and interact with this patient through audio-visual and interact with them to provide care and help co-manage these complex patients. So we will bring in all these experts and into the rural area and have a team approach to healthcare. On the far screen over here, you'll actually see our telehealth call center. That is where our telehealth nurses are operating 24 hours a day, and they're connected, monitoring all this information that's being collected from the patient and from their home. And they know exactly what's going on with these patients remotely. So they don't have to wait till their next checkup visit in 6 months or a year to find out that their glucose level has been elevated for that entire time. We'll know that and can intervene early and change their whole care plan to make sure we control this disease. This is going to be life-changing. The patients are excited about it, the community's excited about it, and University Medical Center and all of our partners are committed to making this a success and making Mississippi healthier. Okay, great. We'll be around if you have any other questions, but we're excited about this and thank you for being here.
Can we
Okay.
look this up?
Absolutely.
Kristen, tell me what this is.
Okay.
Thank you.